Hi, this is Dr. Christina Stitcher with Family First Chiropractic and Wellness Center. I want to come to you with another parental question and really help dive into enuresis and loss of bladder control, because that's what enuresis means. We'll see it during the day when it's really quite severe. Most parents are dealing with what's called nocturnal enuresis, which is nighttime bed wetting. Now, the traditional medical approach is going to be looking at making sure that they're not drinking too much at nighttime, that they're waking up, they feel that rouse effect, that you have them go to the bathroom before they go to bed, maybe even wake them up in the middle of the night to empty their bladder again, to help really deal with or prevent an accident. Now, when we look at the body and how it's functioning, I love to go back to basics, that your body's designed, it's created to heal and repair itself, that our brain and our nervous system, which is brain, spinal cord, and all the nerves that go and control every single cell, organ, and tissue in our body, is the master command center. And when the nervous system's allowed to communicate effectively and fully with every part of our body, then we should have amazing health. Our bladder should work fully and properly. You look at the bladder and it literally just is meant to retain fluid. So it's meant to hold fluid and then it's gonna fill up. It sends a signal to the brain that says I'm full. The brain should send a signal back to the bladder that says wait, because it's not ready to empty. And then you go to the restroom, you consciously send a signal from your brain back to your bladder, to that sphincter, and you tell it to relax. That's what should happen. Often what we're seeing is if somewhere that communication system's not working, that cycle is not closed, then what's gonna happen is the bladder's gonna fill up like it should. It's gonna, let's say it tries to send a signal to the brain does not receive the signal, the bladder's gonna continue to fill up. And at some point, it's going to have to release. And so what happens when we start having kiddos come into our practice, and I say kiddos, but I'm not talking just like young kids. This is a condition that can be very devastating for adolescents, for teenagers, for young adults, and it's something that's not discussed. And that's the reason I want to take this on, because it needs to be discussed. It needs to be talked about, because when we look at this, it's so important to understand the ramifications mentally and emotionally for kids and for adults that are going through this. And so when I look at this condition, what I'm going to do is I'm going to make sure is that the nervous system is communicating fully and effectively with the bladder. As chiropractors, our number one focus is to make sure that the nervous system is communicating with our body. And when the nervous system is fully communicating with our body, so our brain is talking fully with our body, then our bodies are allowed to heal, allowed to repair old issues, and they're allowed to function like they're programmed and designed to function normally, which is health, which is optimal function. We want to start talking about the fact that when there's developmental issues, developmental delays, milestone issues, where we're missing milestones in our kids, that's not normal. That shouldn't be happening. And so instead of waiting for the next thing to happen, we're not only preventative, we're not only proactive, but the whole mindset we have is let's help grow healthy kids. Let's grow healthy adults. Let's grow healthy families, all by working on the inside. Working on the fact that our bodies can do this, are designed to do this, and then somewhere along the line, it's lost that ability to express itself at its highest level. So that's what we get to do, and that's what we focus on, because it's all about you and your health and your family's health. So if you have questions, you want to take this further, please reach out. This is what we're doing these for, is to help you better understand how your body can work, how your children's health is designed to be, and help optimize overall health, life, function, and to really help make the path easier for our kids. Because let's be honest, it's hard to be a kid and it can be a lot of fun. And so let's help them really express their life and enjoy it at its fullest. Okay, talk to you guys soon.